Primary cutaneous follicular center lymphoma. So primary cutaneous follicular center lymphoma is a type of non-Hodgkin lymphoma. It's an indolent form of non-Hodgkin lymphoma. And it's the most common type of primary cutaneous B-cell lymphoma. So we have several B-cell and T-cell lymphoma that can affect the skin, most of which are T-cell lymphoma. But among the primary cutaneous B-cell lymphoma, primary cutaneous follicular center lymphoma is the most common type. Primary cutaneous lymphoma are classified based on the involvement of the skin without any evidence of systemic or nodal disease at the time of the diagnosis. So B-cell lymphoma, which make up about 25% of the cutaneous lymphoma, have a distinct clinical course and prognosis compared to histologically comparable systemic lymphoma. In this case, primary cutaneous follicular center lymphoma is a low-grade B-cell lymphoma that made up of the follicular center. So it typically occur in the head or neck and trunk region with the excellent prognosis. And as we can see here, pictures showing the head involvement. Usually, clinical presentation include a reddish-brown skin bump, which is called papule or nodule, and sometimes also can be occur with plaque. It can either be solitary or multiple lesion, and most commonly found in the head, neck, and trunk region. The etiology currently is unknown, but the pathogenesis include the monoclonal proliferation of the germinal center derived B cell, and cases with primary cutaneous follicular center lymphoma with disease limited to the skin rarely show any BCL2 rearrangement. Mutation-wise, we have 25% of the cases of primary cutaneous follicular center lymphoma show CREVVP, and 21% of the cases show KMT2D, and 0% of the cases show BCL2 mutation. And in terms of amplification, we have cases seen with REL. Epidemiology show the most frequent cutaneous lymphoma uh, is the primary cutaneous follicular center lymphoma among all the cutaneous B-cell lymphoma. It accounts for over 50% of the cases and usually occur in middle-aged adult with a slight male preponderance of male to female ratio of 1.5 to 1. Histological grading is not applicable in primary cutaneous follicular center lymphoma like in the follicular lymphoma. In terms of the growth pattern, you can see the either follicular, follicular and diffuse or diffuse. Here in the picture, we can see multinodular growth pattern that's sparing the epidermis. So epidermis is not involved, and we have multinodular growth pattern in the dense lymphocytic infiltrate in the dermis. And this is the example of the primary cutaneous follicular center lymphoma diffuse growth pattern. As you can see on the low power, very dense lymphocytic infiltrate and in the dermis and sparing the epidermis. And here we can appreciate these small lymphoid cell, and they are primarily centrocyte with few centroblasts. And immunophenotypically, it will express all B cell antigen, and they consistently express BCL6. CD10 is expressed only in the follicular growth pattern and negative in diffuse growth pattern of the lymphoma. And CD21 and CD35 is seen in follicular pattern but also absent in diffuse pattern. And BCL2, contrary to follicular lymphoma, in primary cutaneous follicular center lymphoma, they don't express BCL2, and as well as IRF4, also known as MOM1 and FOXP1, they're negative in most cases. CD43 is negative, unlike other low-grade B-cell lymphoma, um, and cyclin D1 or BCL1 is also negative. CD5 is negative, and diagnostic criteria to include primary cutaneous follicular center lymphoma is that they are either follicular or diffuse growth pattern, and that are B cell with co-expression of germinal center markers such as CD10, BCL6, and no extracutaneous involvement in any way else except the skin. And differential include primary cutaneous marginal zone lymphoma, which is another low-grade cutaneous lymphoma, and another differential is systemic follicular center. Sorry, another differential will be systemic follicular lymphoma with secondary cutaneous involvement. And so in this case, we have to rule out this very specifically. And the third differential, which is the far not so close differential, because this is a primary cutaneous diffuse large B cell lymphoma lake type. So morphologically, it will show large cells, unlike the primary cutaneous follicular center lymphoma. And that's it for the presentation.